Thank you, and good morning. I'm going to try to pull this down a little bit for a little shorty like me. Good morning, and thank you so much, Rachel. I want to just start by thanking and acknowledging all of the incredible partners for this program and for the entire LA County Arts and Health Week. And I want to thank Supervisor Hilda Solis for leading the motion declaring LA County Arts and Health Week to really uplift the importance of this work, the work that all of the folks in this room are doing, and elevate that to the next level. If we can have one more round of applause for all of our morning's speakers, please. I'm also thrilled that there are so many incredible folks with us who've been gathering with us all week from all parts of the arts, but also health funders, folks from the state level, leaders in the city, community-based organizations, our LA County Arts Commissioners. We've had our president of our Arts Commission, Leticia Buckley, and First District Commissioners Helen Hernandez and Deanna Diaz were here. We've had so many incredible folks, and I thank you, and thank you for joining us. So I am going to take the next little bit of time to share some highlights of what we have been thinking about, what we've been working on at the intersection of arts and health in Los Angeles County, especially rooted in the Department of Arts and Culture. And then I'm going to lead us into our first conversation. Now, folks, I have one of these. I don't know if I should use it or if you should use it, but let's see what happens. Okay. All right. So, as I start this presentation, I'm going to just root us, let's see if it's working. Okay, I'm going to just root us in the mission of the Los Angeles County Department of Arts and Culture. And it is big and broad, which allows us so much flexibility, but it's also really centered by this idea that the arts are vital to civic life and should be accessible for all of our communities and all of our people. And you'll see the way these threads are being pulled through in everything that we do. I also want to uplift some of the ways we think about why we invest in the arts, and especially when having cross-sector conversations, really highlighting that we know that the arts are good for us as individuals, but also as institutions, as communities, and as a region. So the arts are a powerful economic driver, especially in a place like Los Angeles County and California, where we are leading in the creative economy. It's such a significant aspect of economic prosperity. But we also know that the arts are key to health, to well-being, as well as to quality of life, youth development, and has the power to advance social change and narrative change. So many reasons to invest in the arts, and today really leaning into the intersection of arts, health, and well-being. As was mentioned earlier, and I've shared with the head of the NIH Foundation that her remarks in December at a special workshop of the NIH and the National Endowment for the Arts on Music as Medicine really hit home when she talked about the importance of the arts across social determinants of health. And I'm so proud to say that I know that value is shared by our LA County Department of Public Health, and it was embedded in the motion that Supervisor Solis put forward to the board that proclaimed at LA County Arts and Health Week. It also uplifts the role of the arts in catalyzing positive outcomes across all of the domains of social determinants of health that have such a strong influence on our health and well-being. So what are some of the tactics? What are some of the things that we're doing that we're excited about in advancing arts and health? I'm going to take us through a number of things that cut across the Department of Arts and Culture and how we're organized in our different divisions and teams, but also intersect us with many of our other county partners. In our civic art practice, we are commissioning artists to create original new works, permanent works, and to care for the LA County Civic Art Collection. And so many of those works are embedded in the county's civic facilities and infrastructure, and many of them were doing a whole series of projects at our health, hospital, and well-being centers. And just like we heard before from Dr. Gerberding, that she shared with us that statistic, that data that says how singing is good for us. One that I have held on to is Americans for the Arts did a study several years ago that showed that folks who have to have a multi-night stay in a hospital are likely to recover up to 1 day faster if they can see art or nature from their hospital room. Now let's talk about return on investment from that. If we magnify that and put art and access to nature throughout all of our health, hospitals, and recovery centers, we know then that while this is deeply valuable, this is actually a cost-effective intervention as well as being incredibly beautiful and being a way that we're able to build greater inclusion, like this incredible work behind me with art by Floyd Strickland at the MLK Child and Family Wellness Center that really depicts images of local children, including those with developmental disabilities and those that really reflect the communities that we serve. We also know that civic art is a way that we can engage community and heal trauma. We've heard, some of you may know, that Supervisor Solis led a motion to issue a formal apology for the historic practice of coerced sterilization in hospitals, including in LA County, that often happened to those who spoke English as a second language, and in other places happened to women who might be women with disabilities or who were of Black or Latinx descent. And so in that, she wanted to commemorate it, and artist Feng Win, who we commissioned, engaged the community, engaged those women, engaged the people who fought the legal battles, and turned that into a site of both healing, commemoration, and the future of health justice, lifting up their voices through this gorgeous civic artwork that is now at the LA General Medical. When we think about our future, we know our future is young people, and through our Arts Education and Youth Development Division, we are expanding access and equity to arts learning for all students. We have several strategies in the ways that we do this work, but they in many ways started with the school system and the school districts, sort of lowercase d democratic, where are we going to find essentially all youth? And so ensuring that every child has access to the arts, because many of us know that there's a history where the arts were either pulled out of our schools or where there is disparities, where we see that schools that are in more low-income areas or English language learner areas or that don't have a strong donor base don't have access to the arts. And so through advancement grants, we are funding arts in schools, music, instrument purchases, and anything else you can name that pushes arts in schools. We also have partnered with the LA County Office of Education, funders and stakeholders to develop the LA County Blueprint for Arts Education, so setting really the policy and regional vision for cultural equity in arts learning. And much of this work we do through a public-private initiative that we do called the Arts Education Collective with funders, many of them in this room, as well as stakeholders, school districts, county departments, and more. But in addition to a broad Arts for All approach that looks at the 1.5 million students in our schools, we're also advancing arts in community, both as social engagement and even as a preventative strategy to ensure that our young people can stay out of any negative behaviors or stay out of systems, and we're using it as a way to engage those that may be in systems-impacted communities. So one approach I'm going to highlight today is a program we call, or an initiative we call, Creative Wellbeing. The Creative Wellbeing is an approach for supporting, especially prioritizing foster youth, that was developed collaboratively by staff from the LA County Department of Arts and Culture, together with the Office of Child Protection, the Department of Mental Health, as well as community-based organizations and partners from the Arts for Healing and Justice Network. And the primary focus of Creative Wellbeing is to really meet young people and folks where they are, and to integrate arts-based, healing-centered arts education as a non-traditional mental health support and a way to process trauma and have positive outcomes. There's also an intentional focus on supporting not just the youth, but the adults who care for them in these systems. This program was developed collaboratively, as I've mentioned, by it takes a village, and it's now being implemented by all these partners. We've got folks at UCLA, we're doing professional development through platforms, and so many folks, including funding from mental health, that began this work. And it's implemented by many community partners and teaching artists. We're currently contracting with 27 different arts organizations in Los Angeles County across all different artistic disciplines. About 22 of them are members of the Arts for Healing and Justice Network, and folks you may know, such as Actors Gang or Armory Center for the Arts, Homeboy Art Academy, Jail Guitar Doors, Tia Chucha's Centro Cultural, Versus Style, Hip Hop, Breakdance, Right Girl. All of these and more are our partners in delivering this vital work to our young folks. And I'll just note that in recent news, and I think we've got Joan Weinstein of the Getty Foundation here who will be able to attest that in recent news, the Getty Prize, which went to noted, incredible artist Mark Bradford, now had a new dimension where he was given the opportunity to select an organization to receive a new $500,000 award, and he selected the Arts for Healing and Justice Network for the incredible work that they are doing, and we're so proud to be part of that work and part of that support. So thank you for that. So working together, county partners, artists, paid youth content advisors, we created a creative well-being curriculum guide that you can find on our website. It has gorgeous original artworks and really just it talks about the process and really some of the key tenets in this work of providing, what does it mean to provide healing-centered arts engagement for young people and arts-based professional development for the adults, the social workers, the educators, the parents, the families, the teachers who are working with those youth. So I invite all of you to share that. But I'm also excited to say that we are just completing a new program evaluation of creative well-being done by our partners at Harder & Company. And I want to share for you just a few of the findings from this research. Through the research that Harder & Company and our staff, because we actually have research and evaluation, a small but mighty team inside the Department of Arts and Culture who joined as well in this report, we found that participating in creative well-being meant that young people experienced positive social and emotional well-being, more happy, more joy. They also learned about not only gaining art skills, but skills in emotions, skills in technical skills, skills in relatability, and learned about the cultures of other people. And they experienced more confidence and less anxiety. And they then shared and transferred these to family members and other folks in their community. We also found that for the adults participating in the program, the adults who care for the youth, it positively affected their ability to empathize with the young people that they're engaging with. It gave them more insight and skills in how to integrate the arts into the programs they may be providing, like at foster youth group homes and other locations where this work is taking place. And they also were able to access self-care through the arts, bringing arts into non-traditional settings to ensure that they can heal as they help others to heal. We also found that we're shifting systems through this work. We now have county department partners who are integrating the arts into their meetings, and we're able to now bring this work to so many new places and spaces with nurses, with other clinicians in our public health and our health services and other places all around the county. I want to also just briefly mention, related to this work and bridging beyond it, that we are also focused on the intersection of arts and health, but with a justice lens. And so we are also one of the leading providers of arts programs for the youth that are in the county's justice camps, detention camps, and halls, ensuring that no child is left behind when it comes to access to arts programming. And beyond that, we've been able to integrate arts programming into the county's innovative model for reentry centers, where folks who are returning citizens and who come to get various systems and referrals can now also get a referral for arts programs. And so we've had Fabian Deborah, who's an incredible artist from Homeboy Art Academy. We now have Sabra with Creative Acts, who's here with us. We've got the California Alliance for Traditional Artists working with us, and we've got our Justice Care and Opportunities Department, JCOD, for LA County, giving referrals for returning citizens and their families to now experience the arts. So I'm really excited to learn how this will flourish as we continue to do that work, as well as partnerships with our county departments at the Office of Violence Prevention and with Department of Parks and Recreation and Parks After Dark, and again, serving youth at Los Padrinos and other juvenile halls, and with our folks in the Department of Children and Family Services. Have to also mention just briefly that, of course, we are a grant maker, and so we're funding hundreds of arts serving and equity building organizations that utilize the arts in their mission to bring arts into the community, to be community hubs, and to lean into that intersection of arts and health. So many incredible organizations served through our organizational grant program, Community Impact Arts program, or the Arts Internship program, as was mentioned before. Too many to mention. Literally, it's about 650 organizations we're funding at this time, but of course, happy to lift up folks like LA Commons, or Critical Mass Dance Company, or Alzheimer's of Greater Los Angeles using the arts, or Invertigo Dance, who's doing dance for those with Parkinson's, and so many more. Thinking about cross-sector, through the Creative Strategist Artists in Residence program, Supervisor Solis talked about, we're placing artists in county departments, and we've had incredible projects. You can see some of them here in terms of the storytelling project that Supervisor Solis mentioned. Here, we've had artist Carol Zoe, who was on this program last year, who was building cultural programs engaging our older adults at county senior centers through incredibly culturally responsive programs. And on the left, you'll see a new program we just did this May, where we placed an artist with County Human Resources to embed in their wellness program for county employees. One of the largest employers in the Southern California region, the county employs 100,000 people, nurses, doctors, you name it. And so thinking about the role of the arts, the artists came up with the idea of a festival, and we held the first ever inaugural LA County Employee Wellness, Arts, and Culture Festival, hosted in partnership with Arts and Culture, Human Resources, and our host partner, LACMA, and we showcased work of the county employees as the artists on LACMA's Plaza and had access to all of the exhibits there. It was a wonderful day, and bridging, again, arts, health, and well-being, and avoiding staff burnout, building connection through the arts for employees. A lot of this work is rooted in a cultural policy that really gives us the bones of kind of what we hope to achieve here. And so this really will continue to guide our work looking ahead, where we hope to continue to build on these promising practices, sustain and grow this work in partnership with many of you and so many others, and look to really implement the Cultural Policy Strategic Plan, which has even more ideas of expanding artists in residence, funding our free concerts program, and embedding those in hospitals, and so many more. So I will just conclude this portion by sharing a couple of announcements along the way. And programs I just mentioned, I'm really happy to say that our flagship organizational grant program, the Board of Supervisors and CEO, did just this year increase a $1.15 million increase that is now going out to the hundreds of organizations that we fund. So over $5 million just was confirmed to be going out this year. I'm thrilled with that, and thank the Board of Supervisors and thank all of those organizations. I'm also thrilled to say that through our partnership with the Department of Mental Health and their access to state mental health Services Act dollars, they are going to continue to partner with us to bring creative well-being to more young folks and adults. With $3 million in state mental health funds, we are going to turn into investments in community-based organizations teaching artists for arts programming is coming up. And we'll be partnering again with the Department of Public Health to bring art and artists into Vision Zero and street safety coming up as we do a large federally funded project for the county. So want to reflect on this moment and all that is happening in the field. We are truly at a tipping point, I believe, with so many promising practices and so much more we can do to increase awareness, build collaborations and partnerships, shift policy and systems, and build more resources for this work. And I know we can do it together, so thank you so much.